The first question came in asking, after 2 failed rounds of IVF with endometriosis, what would you recommend going forward? It's always very difficult to answer questions where you don't have a full picture. And I would suggest that anybody worried about their fertility with endometriosis contacts an expert to go through what their treatment would mean to them. If you are using IVF, either because of a delay in trying to conceive or because there's been damage to the tubes which transport the egg to the uterus, then tailoring a treatment cycle is more to do with age, ovarian reserve tests, AMH and natural follicle count, than a specific pathology. When we look at endometriosis, it may affect how you respond to the fertility medication, and that's a determinant of your ovarian reserve. So we want to see what your ovarian reserve tests are so we can stimulate the ovaries optimally in an IVF program. We also want to have a look at how your embryos have developed in the laboratory. So getting information when you're sitting down for a review with a consultant is key. Having that information prior to a consultation makes for a better experience in the consultation itself. At TFP, we like to prepare before we meet couples to discuss the options with them. So having a full set of notes if you've had treatment and another IVF unit is important. Having some baseline tests like a natural follicle count scan, which assesses the number of follicles in the ovary and any other pathologies that may impact on your fertility treatment, implantation, stimulation, is very worthwhile. Having an up-to-date AMH level is also important because this will determine how we may stimulate your ovaries. Looking at the male side is also important because people with endometriosis may well have a partner who have problems with the sperm. About 50% of the couples that we see here at TFP will have a joint cause for subfertility, and where a male factor may be also present. So my advice when you're looking at repeated cycles of IVF is get as much information as possible so we can tailor a treatment to you as an individual, as a couple.